Hi guys, hope all is well. My channel's been a bit dormant because I've been trying to put things into place for my registration with the General Medical Council in the UK. So I haven't had a chance to do much videos. So I'm just going to talk about a few things today. Well, first off, I'm just going to talk about the registration process for the General Medical Council in the UK, as well as I'm going to go through some ATLS and just keeping it short with that there for now. So the first thing over the General Medical Council, which was interesting, is that they require a certificate of good standing from every place that you have been employed with over the last 5 years. For most people, that will be pretty easy because if you studied and worked in one country, you just get it from your one medical board. But I am from Barbados. I studied in Trinidad, did my internship in Trinidad, and then I moved to Jamaica. So now I'm doing I'm working in Jamaica, and I've been working in Jamaica for the last 3 years. Um, so what was interesting is that I had to now apply back to Trinidad to get a a letter of good standing from them, and then I had to apply here in Jamaica to get a letter of good standing here in Jamaica, which wasn't too long. So I needed that. I needed my primary medical qualification. I needed my primary postgraduate qualification, as well as a picture of the picture page on your passport. You need that as well too. And for some people who don't have English as a first language, you're going to need the IELTS, but English is my first language, so I chose to do the exemption rule where you have a form that has to be filled out by your employer to basically tell the General Medical Council that you perform your duties in the English language, as well as a waiver form. So after you do all of that, you have to then now compile those documents into a PDF or WinZip form. Oh, by the way, if you have not worked since graduating from medical school in a medical capacity for those 5 years, you actually have to submit a letter of good standing from your previous employers if it wasn't in a medical capacity. Okay, so that took about a week or two, depending on, well, week and a half, give or take a few. So I got all the documents. So once you get all the documents, you have to put them in either PDF or WinZip form, as I mentioned before. You put them in the form, and then you email them the documents. Prior to this, however, when you go to the General Medical Council website, you are supposed to fill out you're supposed to sign up as for an account on on the GMC website, and then you're going to be taken through a series of steps where you're going to have to enter in the route in which you're entering the UK for a post. So whether you did PLAB, whether you did MRCS, MRCP, you name it. So I did all of that, and then you have to pay a fee. So the fee is over 400, give or take £400, give or take, which is quite expensive, and it's valid. So when you pay that, they then send you an email right afterwards saying that you have to submit the aforementioned documents. And once you submit those documents, once that email comes, you have 28 days to submit those documents. So I got through with that. So now I have submitted everything, so I'm just waiting for them to tell me whether or not I have to come up for the verification. And when I go up for the verification, I then have to bring up all the documents, the hard copies of the documents to show them. And hopefully then I will get General Medical Council registration. So you actually have to fly up to the UK to get, it's called the identity check, where they look at your passport and look at you and they see that you are who you say you are. So that's this General Medical Council registration, which, if you think about it, is quite expensive because it's £400 for the GMC fee, and then it's to fly up. And depending on if you need visa and a whole host of stuff, it's pretty expensive. So if you're looking to try to get a job in the UK, just start saving from now. Okay, so we're going to talk a bit about ATLS. The ATLS is the bread and butter for the MRCS examination. If you don't know that, there for the examination, both the Part A and the Part B. Mostly Part B, because they actually asked me in the examination. I think I was asked it. They were one twice in the exam. and the examiner needs to know that you're safe and competent in this. So it has 5 parts: airway, breathing, circulation, disability, and exposure. So you come to a patient, this is the scenario, you come to a patient, the patient is lying on the ground, they've been struck by a car. This, God forbid, they've been struck by a car. Whether it be on the street or and you have your carry-on with all the stuff that you need to resuscitate this patient. Let's just assume they're in the accident to the emergency department and you've been called. What's the first thing you do? Now A is for airway, so you just check the airway. So there's a look, listen, and feel. So you look to see if there's anything obstructing the mouth, and the mouth to see if there's anything obstructing the airway. You listen for any breath sounds, and you feel to see if there's any breath against your cheek. You want to have C-spine control. So the reason why you want to have C-spine control is that you don't want to end up moving the patient and you damage this patient's spine and this patient is paralyzed. You could end up doing more damage than good because you haven't assessed this patient to see if they have a stable C-spine. So it's best to stabilize the C-spine. And this can be done with sandbags, collar, as well as a strap that's usually placed over the head. The next thing you want to do after you do the airway, you want to put on a mask over the mouth, which is by a non-rebreathable mask, and you set up high flow oxygen to this patient. You want to also check, well, we're now into breathing. Sorry, I didn't tell you. So breathing. You also want to check and see if it's the trachea central. Once you check the trachea central, you want to auscultate. You're going to auscultate on both sides to see if the air entry is equal bilaterally and symmetrically. And you also, and this is anteriorly and posteriorly. Okay? Just bear in mind that the ATLS is carried out in a team. So while you're doing one thing, somebody else will be doing another thing too. So during this time, a person could very well be doing the C part, which is the circulation part. So that person is setting up 2 large bore IVs and giving you crystalloids. But prior to that, they would have taken off bloods for CVC, group and cross match, renal function test, liver function test, PT, PTT, INR. They would have grouped and cross matched for about 4 units of blood. Somebody might have even taken off a venous blood gas or an arterial blood gas, depending on what the scenario calls for. A person might have put on an SpO2 monitor on the patient's hand. Cardiac monitors might have been placed on the patient, but should be placed on the patient. It's all going on at the same time. You understand? I hope you understand what I'm saying, right? So after you do the circulation, and you have taken off your bloods and sent them off to the lab, you want to ensure that this patient has fluid. So you want to give this patient, you can give them about 1 liter over an hour or half an hour to an hour. And this is through, you want to do it on both sides. So you have to assess this patient's circulation prior to doing this. So prior to doing this, you would have been feeling this patient's pulse to determine if it's within normal range, if he's tachycardic, or if his pulse is too low. If he's tachycardic, this person could, and the patient has no obvious signs of bleeding on the peripheries, or there's a possibility that this patient could have an intra-abdominal bleed because it's trauma. This patient's been hit by a car. So there's so many things that can rupture within the abdomen. This can be the liver, the spleen. This person can have blunt trauma to the abdomen. They can also have trauma to the major blood vessels that go into the lower limb, which should be the aorta. There's so many things. Aortic rupture, the tear. Who knows? So how do we assess that? So, mind you, at this point in time, we will the next stage will be disability. So you want to assess this patient, and possibly, well, you want to do a focused abdominal sonography for trauma, and this will tell us if there's any intra-abdominal bleeding. You also want to do a trauma series. Consider a urinary catheter, a nasogastric tube at this point in time. Exposing this patient to do and the last stage will be the exposure to do a full reassessment of this patient. Now, in the examination, the scenario doesn't come very black and white. In other words, they don't come and say, tell me ATLS protocol. What they do is they bring a scenario, like I tried to give you off the top of my head a scenario. So they bring a scenario and then they tell you, what would you do? Now, interesting things that can happen on wards. For instance, you come to a patient, the nurse calls you in the night and says this patient has just started suddenly breathing short. you have to adapt to suit. You still go through the airway, breathing, circulation, but that doesn't mean that you don't try to do a focused assessment as well too, because you have a list of diagnoses that you would be thinking: a sudden onset of shortness of breath in a patient who's post-operative or in a post-operative period. You'll be thinking this patient might have a pulmonary embolism, possibly a cardiac event. These are things you have to look for. One thing that I remember in my exam that I'm under the pressure I forgot is that in my assessment I forgot to assess the patient's calf, because if you're thinking of pulmonary embolism, you'll be looking for a deep vein thrombosis. So just remember that it's a whole patient, so you want to make sure that you don't miss these things, because a pulmonary embolism carries a mortality of about 40 to 50%. If untreated, it carries a very high mortality. I hope you like this video, and I'm going to try to go back through it in more detail with some written stuff in the background, and listen out for some more videos.